Hi, I'm Dr. Wasim and welcome to my Derm-classes. Today's lecture is on hair shaft disorders. This was one of the requested videos, but unfortunately it was a bit delayed. So in this lecture, I'm basically intending to teach you on how to identify clinical symptoms with which a patient can present to you, as well as how to diagnose them. So let's get started. So the question is, what are the symptoms with which the patient can present to you? So it can either be asymptomatic, or the patient can present with complaints of alopecia, or the patient can present with complaints of very frizzy or very fragile hair or uncombable hair. So these are the different symptoms. So how can you classify the hair shaft disorders? So these are basically classified into two different categories: the one with hair fragility and the one without hair fragility. So let's see what are the different diseases under each categories. First, hair shaft disorders with fragility. So these are basically trichology nodosa, trichology invaginata, monolithics like hair, pili torti, then trichothiodystrophy dystrophy, and bubble hair. So these are the main causes for hair shaft disorders with fragility. And coming to hair shaft disorders without fragility. So these are basically woolly hair, uncombable hair syndrome, and then you have loose anagen hair syndrome, then pili multi-gemini, pili bifurcati, pili annulati. So we'll delve into detail about each of these conditions. So now let's see what can be the causes that leads to these hair shaft disorders. So these are generally divided into genetic ones and acquired ones. So as we know, the genetic ones are less modifiable. So let's see what are the acquired ones. So these can be divided into physical and chemical. The physical ones are the excessive use of hair straighteners, ironers, the heat, etc. And the chemical ones are again the chemicals that's used to soften the hair, to straighten the hair, change the hair structure. It can also be caused because of certain hairstyles like ponytails, etc. And then now let's delve into each cases, trying to identify clinically and microscopically what the hair shaft disorder is. So given us a picture of a baby presenting with sparse hairs. So the clinical features can be very sparse hairs and very dull hair after a few months. So at birth the hair was normal, and after a few months the hair became very lustreless and fragile. And sometimes they can say that the hair doesn't grow long enough for a haircut. So these are the other complaints that you generally hear. And on examination, as you can see in this picture, there's patches of short hairs, and you can also see follicular papules. Sometimes the child can have associated keratosis pilaris or nail dystrophy. So let's go for the microscopic appearance of the hair shaft. So be aware that you need to take the proximal 1 to 2 inches of hair in terms of trichoscopic or microscopic examination. So as you can see, this is the trichoscopic image, and here you can see there is a progressive thinning or intermittent thinning of the hair that gives a beaded appearance to the hair shaft. So you can pause the video for a moment and think what the disease can be. So this is nothing but monolithics. So the name is actually derived from the Greek word, which basically stands for necklace, so which gives a beaded appearance. It's because of the beaded appearance of the hair shaft. So this is again another trichoscopic image of monolithics like hair. So what happens is that the hair is very thin in the internodal area because there is no medulla, and the hair easily breaks at this site. So the genetic analysis shows that it can be autosomal recessive or autosomal dominant inheritance for this, and the prognosis is that it usually improves with time, and in very rare cases it can persist. In those cases you might need to treat with minoxidil, retinoids, and also give psychological support. So this is a brief information about monolithics. So let's go on to the next case. So this is again a baby, as you can see in the picture, presenting with patches of hair loss, and as you can see the hair looks very frizzy. So the complaints are patches of hair loss, which is breakable, short and sparse. So we just go for the examination of microscopy of the hair shaft, and then you can see that there is a twist in the hair shaft with a flattened hair shaft. So maybe you can pause for a moment and think what the disease can be. This is nothing but pili torti. So as the name suggests, there's a twisting of the hair shaft with flattened hair. So again, this results in hair fragility. This is yet another picture here which shows twisting of the hair. Coming to the next causes for the pili torti, it can either be acquired or it can be congenital. So the congenital causes are generally autosomal dominant. There are certain diseases that's associated with pili torti. These are basically ectodermal abnormalities, Bézic syndrome, Menkes disease, Johnston syndrome. So the significance of this is that once you get a child with pili torti, you need to look for any underlying abnormality. So for example, in Johnston syndrome, you can go for sensory neural hearing loss. In Menkes disease, you can evaluate serum copper and ceruloplasmin levels. So all these things, you can look clinically for any other features that's suggestive of these congenital abnormalities. Coming to the acquired causes, these are basically anorexia nervosa, lupus erythematosus, or retinoid treatments. So these again is a modifiable causes. So in case you find the patients on retinoid, probably you can try and taper them, and you can try and treat the lupus, which can eventually lead to treatment of pili torti in that case. And again, anorexia nervosa. So these are the significance of treating acquired causes. So anyways, the management is basically figuring out if it's congenital or acquired and treating accordingly. Coming to the next case, again patient presents with fragile hairs and alopecia, and when you can see the trichoscopy, that there is some as you can see, there's a hair shaft, and inside you can see certain encircled things. So these are nothing but air bubbles. So this is again nothing but bubble hair, and this is because of application of heat on wet hair. So this can be applicable to people who wet their hairs and then dry them with hair dryers immediately. So this is yet another picture which shows air bubbles inside the hair strands, and this again causes fragility of the hair and easy breakability of the hair. Again, the advice can be to improve, modify their hairstyling methods. So next, again, we get a case of very short, sparse, thin hairs, especially after first year of life. So what you need to see is that the congenital hair disorders generally presents few months to years after birth. So that's something that you need to keep in mind. So let's see the trichoscopic image. So here you can see that there is some node-like structures which is not very clear. So we're going to the microscopic examination, and here you can see that there is a hair shaft, and then you can see a cup-like structure. So this is basically because there is a sulfur defect in the hair shaft which leads to thinning of the hair shaft, and then what happens is that the hard part pushes or impinges against a soft part, which results in the ball and socket like structure. So this is nothing but Trichorexis invaginator, and this is something that's associated with what we call Netherton syndrome. So generally they'll have a SPINK5 mutation. Coming to the next case, here you can see that there is some small bends and some thickening in the hair shaft. So let's go for a closer look. So you can see that here there is a splaying of this hair shaft fibers. So here what happens is that there is an absent cuticle. So what happens is that the cortex is very much exposed to the external trauma, and then that results in damage of the cortical fibers. So that's why there is some splaying and spurring at some sides in the hair shaft. So this is nothing but Trichorexis nodosa. And coming to the causes for Trichorexis nodosa, it can either be inherited or it can either be acquired. Again, inherited, it's again congenital causes like Menkes syndrome, Netherton syndrome, trichothiodystrophy dystrophy, or it can be metabolic syndromes like argino-succinic aciduria or trichohepatic syndromes. Acquired causes, again, as we've discussed, it's like excessive chemicals like chlorine, traction, or excessive hair straighteners. So another classical thing about Trichorexis nodosa is that both the proximal and the distal sides can be involved. So let's see the next case. So again, patient presents to you with brittle, sparse hairs. So this is the trichoscopic image, which is not very clear. So let's go on to the microscopic image. So this is very classical picture. Some of you might have already diagnosed. So this is what we call as a tiger tail hair. So this is basically a polarized microscopy. So what happens in this case is that due to the sulfur defect, there is a lot of transverse fractures in the hair shaft, and this give rise to the alternate the tiger tail appearance, the dark and light bands. So this is basically a sulfur deficiency. So the disease is trichothione dystrophy. So we have certain associations in trichothione dystrophy that can occur as syndromes that can be associated with photosensitivity, intellectual disability, and ichthyosis, etc. And then you also have genes associated. So we have genes that's associated with photosensitivity and genes that's associated without photosensitivity. So this is a brief info about trichothione dystrophy. So when you have a patient with a hair shaft disorder with increased hair fragility, these are the microscopic images that you can see. So I'll just rewind it for you now. You can just pause for a moment and try to identify the microscopic images. So starting with the first image, where you can see bubbles in the hair strands, that's a bubble hair. The second image is nothing but the ball and socket appearance of Trichogenesis invaginator, and the third one is twisting of the hair, which is called as pilitoti. And the first image in the second row is alternate light and dark bands of trichothione dystrophy, and the second image is Trichorexis nodosa, and the last one is monolithrix-like hair. I hope this gives you an overview about hair shaft disorders with fragility, and I'll do another session of hair shaft disorders without fragility. Thank you so much. I've put in the references. So I've basically referred from Rook and Bologna. Apart from that, I have also referred some of the latest articles for microscopy and trichoscopy images. Thank you so much. I hope this helped.